Namaskar everyone. Welcome again. In previous video we focused on mainly protozoan parasite. Today we will talk about another category of parasites, that is Helminthes parasites. So Helminthes generally categorized into two types: Platyhelminthes, Nematohelminthes. Platyhelminthes are generally called as flatworms. Nematohelminthes are generally called as roundworms. Platyhelminthes are divided into two types: Trematodes, that is FLUKES; cystodes, that is tapeworm. So trematode non-segmented flatworms, cystodes segmented flatworms, nematodes non-segmented roundworms. So in this video we mainly discuss about trematodes, and in the next video we will discuss about cystodes and nematode parasites. So trematodes causes a disease, that is trematodiasis. So the disease caused by trematodes are called as trematodiasis. So first disease is fascioliasis. So fascioliasis is mainly caused by Fasciola hepatica. This is very important according to exam point of view. Fasciola hepatica infects man wherever sheep are raised. So in these conditions, primary host is sheep, the intermediate or secondary host is the snail. So in the life cycle, the eggs generally passed by sheep in their fecal matter, and it requires minimum 2 weeks to develop into Miracidium larva. This Miracidium larva infects a molluscan intermediate host, that is snail. And in snail, when Sarkaria emerges, it will insist on a submerged vegetation. When a human will eat this cyst infected vegetation, it will lead to infected a human being. So generally when it affects a human, the larva matures and it will live in hepatic bile ducts, and it mainly affects the liver. That's why it is called as liver fluke. Very important. That's why it is called as liver fluke, because it affects liver. Infection leads to abscession formations followed by granuloma, biliary obstructions, eosinophilic conditions, vomiting and epigastric pain. The next disease is fasciolopsis. Fasciolopsiasis is mainly caused by Fasciolopsiasis buschii. It is called as intestinal fluke. In these conditions, the intestinal fluke have the reservoir host pig. So pig is the reservoir host for this intestinal fluke. So when a human being will generally eat uncooked aquatic vegetables contaminated with encysted Sarkaria of Fasciola buschii, it will lead to fasciolopsiasis in human. It mainly affects intestines, causes ulcers, intestinal obstructions, diarrhea, nausea, vomiting. The life cycle also same as Fasciola hepatica. The Miracidium will emerge, then it will develop, then it will attack the snail, then Sarkaria will emerge, then it will affect a submerged vegetation, and finally leads to human. So the next disease is schistosomiasis. Schistosomiasis is caused by the disease schistosoma. Schistosoma has generally 3 species depending upon their position of spines. So in Schistosoma mansoni, the spine is in lateral positions. In Hematobium, it is terminal in positions. In S. japonicum, it is absent. So it is commonly called as blood fluke, and in this case, the development process is also same as Fasciola hepatica. Miracidium larva will infect this intermediate host snail, and then Sarkaria cyst will come out, and it will penetrate the bare skin of human being while swimming in infected water. So if we will talk about the infection sites, S. mansoni, S. japonicum will infect the intestinal part and lay eggs in that conditions, and S. hematobium will lay eggs in urinary bladder and infect urinary bladder. Pathogenicity, granulomas in lamina propria and submucosa, dysentery, liver diseases, fever, sweating, diarrhea, lack of appetite, and causes obstructive uropathy. The next disease is opisthorhynchiasis. Opisthorhynchiasis disease is caused by Opisthorhynchus. This is called as Chinese liver fluke. In this case, human infections is acquired by eating raw or undercooked fish which harbor Sarcoria cyst. So in this case, same Miracidium larva will infect this snail, then Sarcoria larva will come out. It will infect that fish. When the human will eat this infected uncooked or raw fish, it will affected by Opisthorhynchus. Pathogenicity, it leads to biliary obstructions and pancreatitis. Then paragoniamiasis. Paragoniamiasis is mainly caused by Westermanni, Paragonimus westermanni. It is commonly called as lung fluke. So it will affect the lungs. So human acquires infections by eating crustaceans. Crustaceans like crayfish, crab. When human eats these infected crayfish or crabs or any crustaceans, it will lead to paragoniamiasis. So in these conditions, the infections mode also same. The Miracidium larva will come to the intermediate host snail. Snail will release this Sarcoria cyst. It will infect a crab or any kind of crustaceans. When human eating raw or undercooked infected crustaceans, it will affect that human. So pathogenicity, it will attack lungs, bores pleura, causes chronic cough, night sweat, severe chest pain, and occasionally produce lesion in brain, liver, gut, and lymph nodes. So we will talk about the treatment of all the diseases. In fascioliasis and fasciolophiasis, praziquantel is the main tablet for those diseases. Schistosomiasis, nitrodazole, nilodine and antimony compounds. Opisthorhynchiasis, antimony and chloroquine. Paragoniamiasis, emmetine and chloroquine. So this is all about trematode parasites, and we will discuss about next the cystode parasite in another video, and then in another video we will talk about the nematode parasites. Thank you so much.